the 4 questions are quite important to help enhance our patient care on the ward and patient experience. We find it very beneficial so the patients know and understand why they're in hospital, what they need to happen to get home safely, and when that is likely to happen.
It's important to keep patients up to date with their plan of care so we can plan safe discharge and taking into account their wishes and their needs, and we can share care planning with them, and it's what I would want if I was a patient.
So it's important to keep the patient informed so they understand what their hospital journey is, what it's going to look like, and so they know what the important things to do are in order to try and get them ultimately back out of hospital.
So we have gone about implementing these 4 questions. We've implemented it into our morning huddles. So in our morning huddles there'll be the nurse taking charge of that patient, there'll be physiotherapy consultant and the doctors on the ward as well, and our PPF, which is our discharge coordinator. All together we would look and break down what the patient's in with, what else needs to happen next for them to get home, and then an estimated discharge date. So we've actually created and designed a board to help facilitate this.
So during the huddle, we do the 4 questions, and my role is to do the criteria for discharge, which is what needs to happen to the patient for the patient to go home. So I write it by hand during the huddle, and then I'll put it in the system after the.
Then we'll keep the patient as up to date as possible, and the families of what is going on in the background with social care, care homes, etc., just so that they're most up to date of when they're going to be going home.
As the clinical site manager and patient flow, the 4 questions are really important to keep patients safe, to keep them informed throughout the full journey of patient flow, keeping them in the right area in the right place.
As part of the integrated discharge team, it's important that patients are informed using the 4 questions so that they're aware of what their discharge plans are. Discharge can be complex, so keeping them informed as to when they'll be discharged and where they'll be discharged to is important.
Patient care is the centre of everything that we do. There's no point making all our plans not informing the patient when it's all about the patient. So really, they should be at the centre, they should be just as informed as we are. Between doctors, we want to keep everyone informed, we want to keep the nurses informed, the physios informed, and the patients are a vital part of that plan. So it's just natural, really.
It's important to keep them informed as well as keeping the family members informed, just so as a team we're keeping continuity in what the patients are told and what family members are told, and everyone's on the same page.
Same again, it's just to keep everybody updated, especially the patient and their families, and after doing the huddle, because everybody knows as a team we do the huddle, and after the huddle everybody knows what's happening with the patient, when they get in, how they get treated, how they're going to get discharged and where they're going to get discharged, when. So that's the way we keep the continuity between the hospital patients and their families.
So my top tip would be when patients are admitted to the ward from EAU, for our staff to speak with the patient and ensure that they're aware of what stage in the care that they're at. So if they know what they've come into hospital with, what treatment we are giving them, when we feel like they're going to be discharged, and the date for that.
My top tips would be just making sure that everybody's aware of all the information, and it's quite consistent so that all our patients, families, they're all up to date and there's no confusion.
If they don't keep telling you things, you don't know where you are or what's happening with things, and I just like to obviously know where I am up to date with stuff, so it is important.